McGraw.
Yeah, thank you for having me today. My name is Peter McGraw, and I work for the Hogg Foundation for Mental Health, and I just want to speak very briefly about DISH's exceptional item number 8. As we're all aware, there are many Texans with mental health conditions that go without necessary treatment. For people with very serious and persistent mental illness, this often leads to a vicious cycle of homelessness, criminal justice involvement, hospitalization in state psychiatric hospitals, or utilization of really expensive health services through emergency rooms. Often the missing and crucial component of a service array that can really support their stable and independent livelihoods is supportive housing. And the good thing about supportive housing is it's also much more cost effective than hospitals and the criminal justice system. Depending on where the specific supportive housing project is and what services are offered, cost estimates vary between $20 and $50 a day, and that's opposed to $400 a night in a state psychiatric hospital and over $100 a night in the criminal justice system. There are 2 items in exceptional item request number 8 that will support or will promote supportive housing for people with mental illness in Texas. The first is a request for a combination of short and long-term rental assistance funds for people with mental illness, and that's just to help them get into affordable housing as opposed to living in homelessness. The second is a request for funds to pursue a 1915I section waiver or a state plan amendment to Texas' Medicaid program. Recent changes in the 1915I waiver provide flexibility to the states to really target a broad service package to a very narrowly defined population. In this case, it's going to be people who have long-term stays in state psychiatric hospitals, some of the most vulnerable people in Texas and certainly some of the most difficult to treat. Total return on investment for the exceptional item number 8 is estimated to be $39.2 million. There was another item within exceptional item number 8 that I want to speak to just very briefly, and that's the 10 beds that will be purchased at residential treatment centers that would help parents and children who are at risk of having relinquished their child to the state to receive necessary behavioral health services. There was a short discussion when DFPS was presenting about whether or not parents could enter into a joint conservatorship with the state when they have relinquished custody of their kids, and I think DFPS presented information that said that they will try to pursue that option. At the Hogg Foundation, we actually have specific information from DFPS that they will not do that, and if the parents are savvy enough to seek legal assistance throughout that process, then they may be able to get a joint conservatorship, but often this does not happen. Another option that is an alternative to the allocation of beds is the YES waiver, which will provide community-based services to children with serious and emotional disturbance. And we encourage this committee to seek expansion of that waiver. Thank you.
Thank you. We appreciate your testimony.